Hello, you guys. I'm so excited. We are going to be talking about postpartum tonight. Bria, who is a local doula, is going to be joining us anytime soon. So, while you guys are watching, if you have any questions about postpartum or anything specific pregnancy related, just let us know in the questions down in the comments, and then we will try to answer them.
Yeah. Hey,
Hi, how are you?
good. All right,
Good.
hey Danny. All right, Bria, if people have not watched the pregnancy one, let's do intros again so that they know who you are, what you do, where you're at, and all those good stuff.
Yeah. So hi, my name is Bria. I am located in Minneapolis. I'm a mom of two little girls and a birth and postpartum doula. And I met Dr. Crystal a couple months ago, and we just connected immediately. We have a lot of the same philosophies on wellness and care, and especially in pregnancy, labor, and birth.
For sure. And for those friends who are joining us who do not know me, I'm Dr. Crystal Vang. I am a pediatric and women's health chiropractor here in Blaine, Minnesota. And we see a lot of pregnant mamas and a lot of postpartum mamas and a lot of infants. And so Bria and I definitely connected on a lot of similar health philosophies. And that's why we are doing this pregnancy and postpartum series. Um, okay, so I wanted to start off by saying that for me, I truly think that postpartum care starts during pregnancy. We tend to think of postpartum as its own separate entity, its own separate thing after pregnancy, but it really matters how you take care of yourself during pregnancy because it sets the foundation for how well or how bad your postpartum healing is going to go. And so I would tell moms one of the best things you can do for your postpartum healing and your body, mentally, physically, is to get care and to really have a good self-care routine during pregnancy. Because sometimes we then say like, okay, now I've got my baby and I need all this care. And yes, you can definitely do that, but it helps a ton if you do a lot of your care during pregnancy. And so that's what I say. It starts during pregnancy. Can we start right when you give birth to your baby? Yes, absolutely, but we prefer to start ahead.
I wholeheartedly agree.
Mm-hmm.
I think for me, postpartum is something that a lot of people forget about or they put on the back burner.
Mm-hmm.
But it would be like planning your wedding and then not thinking for 1 minute about your marriage.
Yeah.
You're not
There's a
setting yourself
lot.
up for success.
Yeah, for
Yeah, so I include all of my clients, or I encourage all of my clients to have a postpartum care plan. And so this is something that I have a template for, and we work through together and we talk through together what to expect and what to plan for. So day 1 through 7 postpartum, who's bringing you dinner? I want my clients to be writing down. On day 1, my first day home from the hospital, my mom is bringing over dinner. On day 2, we're ordering pizza. On day 3, they need to have that plan because they need to be eating. Who's going to be getting groceries on day 5? Who is going to be, all those things that it takes to run a household? What's your visitor's plan? Um, Everything from your own self-care, which is super important, to who's going to care for your older kids during those first few weeks postpartum. And so to me, if you're going to write a birth plan and think about your birth, you need to also be writing a postpartum care plan.
mm-hmm. And I really love what you said when we met that you recommend nobody comes. Did you say during the first 24 hours or the first week?
The first 24 hours at home, I think it can be really helpful to have a postpartum doula there if you want to help get you settled in, answer questions, figure things out at home. But I really recommend that my clients during the first week not schedule any visitors until they're home with baby. And then they can say, okay, you know what, I'm feeling pretty good. Sure, mom, come on over. But don't make any promises in pregnancy.
Yeah. For sure, and it's such that especially the first 24 hours, it's such a crucial time to be bonding with your baby, and as a new family, or especially if there's siblings there, they're getting used to having a new baby around. So I think it's such a special time to just have as a family. So I thought that was really unique to have you say that. It's like no visitors, which like what you and I talked about. Sometimes it's really hard when grandma and grandpa want to come over and meet the new baby.
Yep. And you could always change your mind and say, you know what, come on over. We're feeling pretty good. But it's much harder to say, oh, you were planning on coming over tomorrow. Now I don't want you to.
Yeah, for sure, for sure. One of the things that we always talk to our moms about is how calm their nervous system is during postpartum. Because a lot of the times, I was just talking to one of my mamas about this today. A lot of times, you guys are constantly in fight or flight. You hear this even. I was always talking to a patient. She goes, even when I'm in the shower, I hear my baby cry, and my baby's not crying. So it's like these phantom cries that make mom be in fight or flight mode. And so when we're in fight or flight mode, and your body and you're mentally and emotionally stressed out, you're not going to be producing as much breast milk as you want. You're not going to be healing. You just went through this huge labor and delivery event, which is really hard on your body, and your body needs to heal. And we don't heal when we are in fight or flight. And so my job, my job as a chiropractor is to help the nervous system be balanced out so that you are not in fight or flight and your body can heal, because there's so much healing that needs to happen during postpartum. And one of the things that we tell patients to do is to get adjusted so that we really start to increase the body's ability to heal, because it's self-healing. We just have to give it what it needs.
When do you recommend that clients see you postpartum?
It's completely up to them when they want to come see us. So we have a lot of moms who are under prenatal care, and they will go from the birth center and they'll come get adjusted, and then they'll go home. And then there are others who they're like, we're just gonna come in like 2-3 weeks. Perfect. So it's always to their comfort level. So I've adjusted a mom and a baby 4 hours after birth, and that's a beautiful thing. So it depends on what the parents are comfortable with.
Sure. I love that you said that stress levels can affect milk production, because it's so true. Stress levels affect everything.
Yeah.
And this is where I really love my job as a postpartum doula, because to get to be invited into someone's home when they are just home from the hospital or just home from the birth center, and help them get settled into their home and bring down those stress levels, and not just for milk production, but also to help prevent postpartum depression and postpartum anxiety, and really get them set off on the right foot. That just brings me so much joy. And I just think that it's something that everybody needs. Everybody needs someone to meet them at their house when they get home and help them settle in and cook a meal and teach them about baby wearing and get the baby to sleep. And all of that in the first few hours at home are just so crucial.
And when you think about stress decreasing your production of breast milk, we hear that a lot, but we don't realize, or many moms don't realize, it's all a hormone reaction, right? Because when you bring baby home, you have all of these amazing mama hormones that are helping you make breast milk and that are helping you bond with your baby. But when you're stressed out and that stress hormone gets increased in our bodies, that's what decreases everything else, right? So we have to understand, like you said, stress causes lots and lots of different things to happen in our bodies, and not just the breast milk production.
For sure. And I think it's really important to honor the birth story as well, because 1/3 of births are described by the birthing person as traumatic.
Yes.
And so if you've just gone through something that's really traumatic for you, likely it was traumatic for your baby as well. And so now you're both in this stressed out situation that we need to then help you learn to manage and help you come out of that.
Yes. Yeah. And that's why we see newborn babies, because of birth trauma. And we know that birth trauma happens in completely natural births, whether it's no medicine or no interventions, or whether it's home birth. So you could have the most complete, natural, perfect birth, and there's still some birth trauma that happens.
For sure. Yeah.
Bria, can you talk to us a little bit more about what you do as a postpartum doula? Because in terms of being a doula, you started in the postpartum field, right?
I did, yeah. So I actually started about a year ago seeing clients after their birth. And the reason for that was just my life situation. I was working full-time 9 to 5, and so it didn't work to be on call for a birth. But I started seeing clients postpartum. And as a postpartum doula, you can call me anytime in your baby's first year of life. All postpartum doulas are a little bit different. So some people will say the first 12 weeks. Others have different limitations. For me, it's the first year. But oftentimes, my favorite is when I see clients right when they're home from the hospital. So if you get home from the hospital at dinner time on Tuesday, I'm going to be there at 7 a.m. on Wednesday with breakfast ready, lunch in my bag, and a plan for dinner. And we're gonna do a couple different things. First of all, it's my job to take care of you in your house. So maybe I'm starting a load of laundry, maybe I'm doing some light housework, maybe I'm helping your older child to understand what's going on with baby. Maybe you're recovering from a belly birth and you really need some help getting up the stairs to your bed or down the stairs to breakfast. Really, please don't be doing stairs. But there's situations where I've had clients that just their houses require stairs. So there's that light housework aspect, there's the meal aspect, but then there's also the education and empowerment. It is my job to make sure that when I leave your house at dinner time, you feel so confident going to bed and parenting your baby overnight. And if you don't, then I'm going to stay and I'm going to be with you overnight. So making sure that your baby is eating well. And if they're not, I'm going to be recommending a lactation consultant. Making sure that your baby is sleeping and that they're in a comfortable position, that everybody is recovering well, and that all of your questions are answered.
Yeah, and I love that because I think that most people don't think about when I get home, is there going to be a meal for me, or do I have to then say like, hey, are we ordering out or who's cooking? So I love that you are there providing that support emotionally, but then also around the household, which most people wouldn't think that a postpartum doula does. They would just think, you support the mom and baby and then you go home.
It's the whole house. And it's also going over the birth story, which is a really important thing. And so asking, how is your birth and how are you feeling about it? And giving the birthing person that opportunity to open up and say, I'm feeling so good. Can you just listen to me tell this amazing story? Or on the flip side, like, I'm really confused and I don't know what just happened. Can you help me think through and process? And I work within my scope. I'm not a therapist. If it's something that I feel like you need to talk to a therapist about, I will definitely recommend that. But more often than not, people just need someone to listen to them tell their birth story, to help them work through what happened.
For sure. Which providers or what are your recommendations that for baby and for mama to see within that first week or 2 weeks of life or postpartum?
Yeah, so within the first few weeks, I highly recommend lining up a doula to meet you at your house pretty much as soon as you're home from the hospital. Give yourself a few hours to settle in, and then have a doula come over and help you settle into your home, help you settle into your new life, whether it's your first child or your sixth child. And then beyond that, I really recommend a lactation consultant, especially if you are going to breast or chest feed or pump, because even if you think that things are going pretty well, I can guarantee that you will get benefit from a lactation consultant. I can speak personally. With my first child, I thought everything was going just fine when I was nursing, but every time I latched her, it hurt. And I had all these other people in my life saying, well, Bria, nursing hurts. Nursing hurts a little bit. Just wait. Your nipples have to callus up. It'll be fun. And I went and saw a lactation consultant, and she took a look, and she was like, you're bleeding. That's not normal. Don't let all these other people in your life tell you that's normal. And I thought everything was fine. I thought we were just going to check in with her and, that she was going to tell me that everything was hunky-dory. But in reality, she had a ton of tips. And without that visit, 4 days postpartum, I wouldn't have been able to nurse as long as I did. So I think it's really crucial to schedule a visit with a lactation consultant, even if you think everything's going well. And you can usually find them in your pediatrician's office. So they're not usually that hard to find. Or I can recommend some for you as well. And then a chiropractor. I didn't see a chiropractor until I was 8 months postpartum, and I wish I had gone so much sooner for myself and for baby. And just my back was in so much pain postpartum from the weight shift, from going from big old belly to medium-sized postpartum belly, because your postpartum belly does not shrink immediately. You will go home from the hospital in maternity clothes. I hate to break it to you. But yeah, I wish I'd seen a chiropractor much sooner than 8 months.
Yeah, and that's why we see our mamas so early, right, or right so soon after the birth. And we also will check babies, so whether they're latching well or they are, rock star nurses from the get-go, we check babies for tongue tie, because it's one of the
I love that.
it's one of the most frequent problem or challenges with nursing is babies get a tongue tie, and if from what I have heard from my patients, the pediatricians don't put an emphasis on it, which is unfortunate. But again, in the Twin Cities here, you've got some amazing prenatal and pediatric chiropractors. You've got doulas, you've got lactation counselors who check for that, and that's amazing because a lot of times it gets missed, and moms are having a lot of trouble nursing, and there's a lot of mom guilt that goes in that when you can't nurse or you're having trouble nursing. So we love to check babies for tongue tie after birth.
I love that.
Yeah,
the Twin Cities. Oh, sorry.
No, one of the things that we check postpartum too is diastasis recti. And so with that, what that is you'll the abdomen. So you have two sides of the abdomen, left and right, and then you'll notice that in the middle there's a separation. And so it's talked about a lot with in conjunction to pregnancy or postpartum, but a person who has never had a child, never had a pregnancy could have it for a woman, and men also get it as well. So it's a separation of the abdomen, so diastasis recti, and it happens to any and everybody, but especially during pregnancy because you just made this amazing baby and your belly increased in size, and that puts a lot of strain on the core muscles. And so with that, one of the biggest concerns is that now your core is very weak, right? So then you have a lot of moms, like you just said, you're not going to go home with a flat belly. You're not going to go home with a six-pack and a flat belly.
No.
It's going to be this like tiny little belly that still looks like you're pregnant, right? And so with that, a lot of moms are trying to, get their pre-pregnancy body back, which is absolutely fine if that's what you want to do. I would tell moms to give themselves time to heal. But a lot of times moms will be maybe 2 years or 3 years after they've had their youngest baby, and they'll say like, okay, well, I still have this little pooch here that I can't get rid of. And then when we check for the separation in their abdomen, it's there. So it's making it harder to get that six-pack abs, but it's also in terms of function creating so many different challenges because your core stabilizes your entire body, right? So when your core and your ab muscles are weak, your low back is, and all those muscles surrounding the low back are working a lot harder to keep you upright, to keep you moving, to make sure that you're weight bearing correctly, to make sure that your center of gravity is still balanced and you're not falling and tipping over.
I think what's really tough about diastasis recti is you look at it and you're like, oh, I have a little pooch. I should do some ab exercises.
Yeah.
And then you make it worse.
Yes. So sit-ups, all you mamas out there, if you have some separation, do not do sit-ups. It's going to make it worse. So you really want to do more gentle exercises for the abs, and then there are specific different exercises that take a lot of brain cells, but that can help get that separation to decrease.
Yeah. There's a frustrating amount of exercise programs out there that are labeled pregnancy and postpartum safe that I would say are not safe. And so if anyone watching this wants some recommendations for either pregnancy safe or postpartum safe exercise programs to follow, I can give you some people that are actually good. But yeah, it's amazing to me how many times I turn on a postpartum workout video and find crunches in it, because that is not good.
Yeah, and in the Twin Cities, there are some amazing pelvic floor therapists, physical therapists that focus just on pelvic floor, because your pelvic floor, depending on the position that you gave birth in, might get completely destroyed, right? And so there are some amazing physical therapists around the Twin Cities that work just for that focus on just pelvic floor, and they will also help with the diastasis recti.
Yes. Yeah, the Twin Cities is such a birth mecca. We're really lucky to live here.
Very lucky. And it's interesting. So my clinic is in Blaine. We're like, I don't know, 20 minutes north, and there is such a huge difference between the Twin Cities and trying to find all these doulas and PTs here in Blaine. And I'm like, I know we're not that far away, but my mamas like to have somebody that's in Blaine.
I can totally understand that.
Mm-hmm.
Yeah. I live within the city limits of Minneapolis, and so I'm constantly looking for, like, was it really in Minneapolis? Or is it in a suburb?
For sure.
But I love that you brought up the PT too. So that's someone else to add to your list of practitioners. And just like my analogy at the beginning, think of this as your wedding. How much money do we spend on weddings? We spend, in Minnesota, the average wedding is $24,000. But then it comes to birth, and we say, you know what? $100 for that chiropractic appointment, that's too expensive.
Yeah.
We've got to this is a life-changing event. They're both life-changing events. So save up, ask for it on your baby registry, ask for money for a lactation consultant, check with your insurance provider, see who they cover, but definitely be thinking about these types of postpartum providers while you're in pregnancy.
Mm-hmm. Yeah. And even if you don't, because you and I talked about it, just because you don't reach out to us or just because you're not a patient during your pregnancy doesn't mean that you can't come to the clinic postpartum, right? It doesn't mean that 2 weeks postpartum, if you are freaking out, not knowing what to do, like reach out to Bria because she's still going to come and support you, even if she didn't know you during your pregnancy journey. Right?
Definitely.
So it's making sure that if you are not doing the planning beforehand, that you still know that these people are out there and you can still reach out when you need help, because a lot of times it can get, I think the newborn phase and being a new mom can get very isolating, and you think that you are the only one drowning in all this responsibility and emotions, but there are a lot of people out there that are ready to help you.
Absolutely. Yeah. And it's never too late. I mean, to your point, you see people years after their baby was born to help start to fix those issues that started in pregnancy.
Yeah, for sure. All right, Bria, where can people find you if they want to see, or if they want to see what you've got going on, what services you provide?
Yeah. So I'm fairly active here on Instagram. My handle is bria.the.doula. And then if you go to the link in my Instagram bio, you can get to my website from there, or just shoot me a message, and I respond probably faster than my husband would like for how often I'm on my phone.
Also, what I would like to say is if you are watching and you're like, oh my gosh, this sounds amazing, and I want a doula, but I don't live in the Twin Cities, or I live in Wisconsin, whatever it is, or you want a prenatal chiropractor, but you don't live in Blaine or anywhere near, reach out to us, because we can still give you some names of people who are around you. I think that is one of the best things about Bria and about myself, is that we don't have to be your provider. We will guide you to somebody who connects with you and who you think that that's your person and that's your provider. Because at the end of the day, we just want you as a mama to feel supported.
For sure. Yeah, at the end of the day, it's way more important to me that 100% of birthing people have doulas by their side. They don't all have to be my clients. So,
yeah, for sure.
But yeah, well, thank you for having me on tonight,
Yes,
Dr. Crystal. This was really fun.
Yeah, awesome. So if you guys want any more prenatal or postpartum information, just message either Bria or myself, and we will get you some good resources.
Thank you. Have a good night.
Bye.
Bye.